Probably this is the first ever virtual award, so that award ceremony, so that's kind of cool. It's always still kind of fun when we can be there in person and we can interact more with the crowd. And we've also had a tradition of singing, but we can't all sing together tonight. The first award is for the Public Health Worker of the Year. And this award recognizes a member who has made a significant contribution in the field of public health over this past year. This award recipient was nominated by Kylie Hall from the North Dakota State University Center for Immunization Research and Education. This award goes to Molly Howell, who's the Assistant Director for Disease Control at the North Dakota Department of Health. So Amy, do you have the video? Mm-hmm.
Public Health Worker of the Year, Molly Howell. Molly Howell is the Assistant Director for Disease Control at the North Dakota Department of Health. She also serves as the Deputy State Epidemiologist and Immunization Director. Molly has not only been a driving force behind COVID-19 vaccine planning operations, but also for the state of North Dakota's entire response to COVID-19.
Molly has been our shining light throughout the COVID response. She is dependable, reliable, truthful, encouraging, all those things that are what we like to see in a leader and are valuable and helpful in how we do our work.
Molly has worked in the Division of Immunizations at the department for over 15 years. During her tenure, she has led the division through many administrations, immunization schedules, legislative sessions, vaccine preventable disease outbreaks, and 2 pandemics. She has remained a steadfast and reliable advocate for immunizations and has worked tirelessly to ensure that all North Dakotans have access to life-saving vaccines.
She's very humble, she's self-effacing, she's not one to bring attention to herself, very modest, but that's probably one of her best qualities. She's just such a hard worker, not looking for attention, always just looking for the next best way to improve the health of North Dakotans.
When the COVID-19 pandemic hit, Molly was in charge of keeping the Division of Disease Control operating, while the director was stationed in the State Emergency Operations Center. She worked closely with other section heads to get the state's case investigations and contact tracing efforts going. She led the department in the development of policies, directing the program, and starting up the investigation process. Soon, COVID-19 vaccine planning became Molly's main focus. Because of North Dakota's outstanding immunization program, we were one of 6 programs selected by the CDC as a COVID-19 vaccine planning site. North Dakota was the first state the CDC visited, and they used their lessons learned and information gathered to inform the rest of their COVID vaccine planning visits.
Molly possesses strong communication, collaboration, and organizational skills, which have produced innovative solutions for vaccine distribution and administration. As a result, COVID-19 shots are getting into the arms of North Dakotans faster here than anywhere else in the nation, with almost zero waste.
Molly has held many leadership positions, such as serving on the National Vaccine Advisory Committee, being past chair for the Association of Immunization Managers, and serving as liaison to the Advisory Committee to Immunization Practices. Molly has a strong work ethic, listens to concerns, and builds up others to become better leaders.
I just want to start off by thanking the North Dakota Public Health Association for this award. This past year has definitely been challenging for public health, to say the least, but I continue to be amazed at what public health can do when we set our mind to something and work together. I feel a bit awkward accepting this award for Public Health Worker of the Year because I know firsthand how hard all of us have worked over the past year and continue to work, especially in responding to COVID-19. I do want to say very special thank yous to everyone at the North Dakota Department of Health. The vast majority of employees stepped up to assist in responding to the pandemic, even though it wasn't necessarily their day job to work in infectious disease. I'm especially grateful to the other staff in disease control and our leadership who really worked tirelessly to conduct case investigations and contact tracing and doing data analysis and providing education, all to try and prevent the spread of COVID-19 over the past year. I don't just consider you coworkers, but we're also friends and family. I also have to say thank you to NDSU's Center for Immunization Research and Education, who, whether they liked it or not, became honorary members of disease control and really played a key role in responding to this pandemic and helping implement COVID vaccination. And then to the Department of Health immunization team, especially, you all continue to amaze me with your passion for immunizations and dedication to making sure North Dakotans are protected, not just against COVID-19, but also all vaccine preventable diseases. And really the reason why COVID vaccination and the immunization division is successful is because of your work and everything that you do. In thinking about the past year, I think the impact of COVID-19 will probably change public health forever, but I do think it will be for the better. We have definitely strengthened our partnership and hopefully shown the public in the state of North Dakota the critical role that public health does play in everyone's lives. And I just look forward to this pandemic being over and all of us being able to get together in person and celebrate all the achievements that we've had over the past year.
So congratulations, Molly. You have not only been a driving force in the COVID-19 vaccine planning and operations, but also for the state of North Dakota's entire response to COVID. We thank you for your tireless work. There isn't enough to say to do justice to your contribution to improving the health and lives of North Dakota citizens. North Dakota is truly lucky to have such a strong advocate on our side to keep our state healthy and thriving. Therefore, again, we are more than pleased to recognize you as the 2021 North Dakota Public Health Association Public Health Worker of the Year. So congratulations, Molly, for a job well done. The next Public Health Award is for the Outstanding Service Award. And this awardee was nominated by Debbie Swanson from Grand Forks Public Health. This year's Outstanding Service Award goes to Teresa Knox, who's a nursing and nutrition supervisor for the Grand Forks Public Health Department in Grand Forks, North Dakota.
Public Health Outstanding Service, Teresa Knox. Teresa Knox is currently serving as the Nursing and Nutrition Supervisor at Grand Forks Public Health. She entered nursing as a second career and sought employment specifically in public health after completion of a practicum at Grand Forks Public Health during her time in college. She was employed in the Grand Forks Public Health Department as a public health nurse from 1994 to 2001 and returned to the department in 2005, serving in increasingly responsible roles.
I just think she brings a wealth of knowledge to the table, and I think that she is an excellent listener and gives great feedback. She draws upon her years of experience in leadership roles, giving examples of stuff that she's gone through, and is able to pass that along, all that experience and information, and pass that along to people that she mentors. And I think that's a real asset.
Teresa served as the Executive Director of Valley Health and WIC from 2001 to 2005. Her commitment to social justice and health equity have been central to her work in women's health, maternal and child health, and tobacco prevention prior to her current leadership role.
She is a strong leader. It's very important to be that in her role, and she's very approachable. The other characteristic of her is that she is a very good listener.
Teresa demonstrates effective communication and strategic risk-taking in her leadership roles and is an expert in policy, system, and environmental change, work that impacts the health of entire populations. One of Teresa's greatest strengths is her ability to communicate to create a vision for public health.
She's really very involved in her community of Grand Forks, and she utilizes her many talents in performing arts. She's actually an actor in a community theater productions, and she's been a professional choreographer for the North Dakota Ballet Company. She also has volunteered as a dancer with our local Dancing with the Special Stars to benefit Special Olympics. And in her free time, she's also taught some fitness classes, and she's just really a great role model for wellness and healthy living. So Teresa not only talks the talk, but she walks the walk.
During the COVID-19 response, Teresa has held multiple roles, from the operations chief to overseeing the responsibilities of her team and ensuring the workforce development needs of new staff hired to assist with the pandemic response are met. She manages multiple programs and grants and leads a diverse team of public health nurses, dietitians, and public health program specialists. As a member of the North Dakota Public Health Association for over 25 years, Teresa has served as a governing council member and as the liaison for the Dakota Conference on Rural and Public Health Planning Committee, a position she held for more than 10 years.
She displays a lot of passion for health, passion for doing the right thing, and passion for ensuring that all people have the opportunity to be as healthy as they can be.
So Teresa, congratulations on being selected for this award. And this award complements your long and distinguished career in public health. You've dedicated yourself to caring for the health and well-being of your community and for individuals within the state. We're pleased to recognize you for the 2021 Public Health Outstanding Service Award. So congratulations, Teresa. And by the way, Teresa, that was a nice Christmas sweater as well, too. So the next Public Health Award is for the Public Health Team of the Year. This award goes to the Grand Forks Public Health out of Grand Forks, North Dakota. And this Grand Forks Public Health Unit was nominated as well by Debbie Swanson from Grand Forks Public Health. This award honors a team that has worked collaboratively on a unique and creative or outstanding public health effort, program, or goal. So congratulations to the Grand Forks Public Health of being nominated and receiving the award for the Public Health Team of the Year.
Public Health Team of the Year, Grand Forks Public Health Department. The Grand Forks Public Health Department has done extraordinary work to protect the health and safety of residents during the pandemic. Their communication activities have been key to keeping the public informed of mitigation strategies to reduce the spread of disease.
More than just this past year, they have shown a true commitment to best practices when it comes to public health. And so certainly the pandemic has caused us to all shift in many different ways, and the Public Health Department is not immune to that. The way in which the team has come together to take a look at the guidance and to implement new strategies, and then also to be willing to adapt to those strategies as we went through and learned more through the pandemic, is something that they did so well, and they did with a commitment to best practices.
During the spring of 2020, mass COVID-19 testing was initiated in response to a large workplace outbreak that required testing a large number of employees, family members, and close contacts. While healthcare professionals were testing individuals with exposures and symptoms, there was a need for surveillance testing in the community. Together with the University of North Dakota, the North Dakota Department of Health, and the North Dakota National Guard, Grand Forks Public Health started a campus and community surveillance testing program on campus. This program has performed more than 20,000 PCR tests and more recently expanded to the Buy Next Now rapid antigen testing.
Grand Forks Public Health as a team has a very productive attitude that allows them to meet these challenges, allows them to pick each other up. You know, when you approach things with the right attitude and the type of professionalism that they do, you know, success is one of those things that will come after that. You know, it's going to follow when you approach a problem with the professional, positive, can-do attitude that they do.
Grand Forks Public Health started its own contact tracing program to investigate cases within the county. The personnel conducted a total of 3,941 case investigations and 2,142 interviews with close contacts of cases working 7 days a week.
We've done so many things to impact the community, and we're fine. In the beginning of it, it was kind of explaining rules and regulations to go by. And as you probably could guess, a lot of the public did not have a good response to that, especially like business owners, for example, who were impacted so much at the onset. But as we started to realize what serious situation COVID-19 is in our area, they started to show so much appreciation. I'll give you an example. So now we have a regularity of vaccination clinics that are going on every Wednesday and Saturday. We have mass vaccination clinics that are going on. And that's the time when we do get recognition. We do hear a lot of praise. We do hear a lot of thank you for everything that you do in the community. And that makes those long 50, 60-hour weeks, you kind of erase those.
Through the leadership of the data and analytics team and Dr. Joe Walls, the Grand Forks County Health Officer, a daily Grand Forks Health Office dashboard was developed and distributed to policymakers and community stakeholders for decision-making support. Dr. Waltz issued health officer orders twice during the pandemic that included mask requirements in public places and mitigation efforts to increase social distancing. Maximizing the use of all available resources and tapping into the expertise of partners have been daily endeavors during the changing conditions. This is evident with the current collaboration with All True Health System to hold community-scheduled vaccination clinics with shared vaccination allocations.
I would say that we impacted the community by showing that we would be there for them. We would do what we can, and we would be open about it. So we didn't always have a quick answer to everything when it came to COVID-19, but we worked at it.
Prior to COVID-19, Grand Forks Public Health was on a quest to become an accredited health department by the Public Health Accreditation Board. Currently, the submission is pending. The dedication to public health overflows through this department.
I'd like to thank the members of the North Dakota Public Health Association for bestowing this Public Health Team Award to Grand Forks Public Health Department. The past year has really been a monumental experience for us as a team to respond to COVID-19, and I could not be prouder of Grand Forks Public Health and all the work that they've done. They've gone the extra mile every step of the way throughout 2020 and now into 2021. There have been some dark days that's required some really extraordinary effort to mount an effective response, but all the members just kept showing up every single day and giving their best and ensuring that the public remains safe from COVID-19.
So congratulations to the team at Grand Forks Public Health. You know, your response during this pandemic certainly reduced illness and deaths due to COVID within that Grand Forks County area. You've done this through extraordinary communication efforts, the development of the Grand Forks County Health Office dashboard, mass testing and vaccinations, case management, and more. Therefore, again, we're pleased to recognize you as the 2021 Public Health Team of the Year. So congratulations and thank you for all the work that you've done. So this is the awards for the 2021 Public Health Awards section. The next section of awards that we're going to be talking about is the Outstanding Rural Health Awards. But I just need to pause for a minute because some of the comments in these videos just reminded me of something that we all need to recognize and be appreciative of. You know, during this COVID pandemic, again, strong people rose to the top and a lot of work was done. A lot of sacrifices were made in spending extra time doing the work to help protect the individuals within the state of North Dakota. And at many times that resulted in a sacrificing of time at home with family. So we want to recognize family and friends as well too of all healthcare workers, public health workers, hospitals, clinics, the North Dakota Department of Health, which did an outstanding job. We just want to recognize everyone for their efforts and for the families at home that were supportive of all of us during this pandemic. So again, the next set of awards are the 2020-2021 Outstanding Rural Health Awards. And this first award presentation is for the Outstanding Rural Health Professional. This individual was nominated by Reed Raymond from All True Health System. And this award goes to the individual who's a healthcare professional located in a rural area of North Dakota who has demonstrated leadership in the delivery of rural health services. This year's award goes to Dr. William McKinnon, the Medical Director of Regional Operations for All True Health Systems in Grand Forks.
Outstanding Rural Health Professional, William McKinnon, MD. Dr. William McKinnon continues to be an exemplary example of dedication, commitment, and vision to the Grand Forks community and region, and has been for over 30 years. He is the Medical Director of Regional Operations for All True Health System. Dr. McKinnon is a board-certified family practice physician and has made his career in the emergency department. Under his direction, the one-call system was established within the emergency department, establishing the network and provision of support guidance and clinical care to the region.
Through his work over the years as an emergency physician, he developed many relationships and managed many patients that were sent to us from the region. And his progression as a leader in the rural health sphere as a medical director of regional operations has only furthered his experience as well as his support for rural health care in North Dakota.
The patient-first philosophy in support of regional providers and their community's patients has been a front-center initiative that he has hardwired into All True. As Medical Director of Regional Operations, Dr. McKinnon has coordinated, addressed, developed, and evolved relationships with critical access hospitals and their health systems, integrating and supporting their efforts to provide great regional care.
He understands that it's not about competition when it comes to rural healthcare, and whether you have an affiliation with All True or not, he's going to do his best to make sure that the patients in your area are served as best they can. Whether that means you're using All True for services or not doesn't really matter to him. He just wants to make sure the patients get the services that they deserve, and usually that does involve All True. And I contact Dr. McKinnon on a weekly basis, and we discuss kind of our strategic plan and where we want to go, and he's always there to help us with that plan. And he's willing to lend us any providers that he has, and it's not just providers and specialists, it's also the electronic health record, it's billing, it's coding, it's really anything that we need to succeed and can do. He's there for us, and I appreciate the fact that I can bounce ideas off of him, and it's been a really great pleasure working with him these past few years.
Through his current position, he serves All True clinics in Devils Lake, Drayton, and Cavalier in North Dakota, and Roseau, Warroad, Crookston, and Thief River Falls in Minnesota. He serves as the Medical Director for Ambulance Services in various frontier and rural communities.
His really passion has been to make sure that those rural areas are getting all of the medical care that they need to receive.
Dr. McKinnon travels at least 200 miles per week and supervises over 100 rural providers that include physicians, physician assistants, nurse practitioners, and paramedics. Dr. McKinnon is dedicated to making rural health professionals successful through education and training. He has been a great teacher in the emergency room and rarely passed up an opportunity to provide meaningful, on-the-spot education to any staff who were seeking to better understand a concept.
After hearing his background and his experience and his education, but most importantly, his passion for the region and for rural hospitals and for the rural communities and how they flow into Altru and how it all works together, that's kind of what sold me on really wanting to come out and work alongside of it.
Currently, he stays in touch with rural facilities, working to ensure what services and specialists he can share with the rural clinics. He is respected, trusted, dedicated, and always available when needed to serve rural communities.
I'm fortunate in my role to be able to support in whatever way I can all the rural healthcare providers at every level in the region that I serve. The return on investment for this involvement is immeasurable, and I thank every one of them for allowing me the privilege of knowing and working with them. And I through the grapevine, I also understood that there were some other people I should thank about this award, and that would be Reed Raymond, who's my dyad partner from Altru in the region. Mark Wayne, who's our Chief Information Officer at Altru Health System, who helps with some of the regional involvement that I have as Medical Director. Also Nicole Nelson, our Administrative Assistant. Marcia Wayne, who was previous Manager of Virtual Health at Altru Health System. And then I also understand that there were some critical access hospital CEOs that were involved in the nomination. So I just want to thank everybody for that. It's an honor, it's a privilege for me to receive this, and I just can't tell you how much I appreciate it.
Dr. McKinnon, congratulations on this award as the Outstanding Rural Health Professional. Obviously, you've gained a lot of respect and admiration from your peers and those that you work with. And because of your diverse and unique work experience as a paramedic, as a nurse, as a physician assistant, and a family practice physician for over 30 years, you have a lot of expertise, knowledge, and the dedication that goes along with it to have gained the trust of those that you assist in delivery of healthcare. So we're pleased to recognize you as the 2020-2021 Outstanding Rural Health Professionals. So congratulations, Dr. McKinnon, and thank you for your work. The next award is for the Outstanding Rural Health Provider. This award is presented to a healthcare clinician whose practice is in rural North Dakota and who has unselfishly made an important contribution to his or her community or the area served. This year's award goes to Brian Tweet, a family nurse practitioner from Northwood Deaconess Health Center. And Brian was nominated by Condetta Ness from Northwood Deaconess Health Center. So congratulations.
Outstanding Rural Healthcare Provider, Brian Tweet. Brian Tweet is a family nurse practitioner at Northwood Deaconess Healthcare Center. Brian has been practicing medicine in rural North Dakota for his entire career of over 20 years. He has provided healthcare to Cooperstown, Binford, Northwood, and the surrounding communities. He is very passionate when it comes to the care he gives.
He shows genuine concern for his patients, and with all the appointments I and my family members have had with Brian, whether they've been routine checkups or more major health issues, I've always found him to treat each matter with that sincere interest and concern.
Many of his patients travel great distances to see him, and he travels to see his patients in rural areas. He spent years commuting from Northwood to Cooperstown daily. He now travels to Binford twice a week, making a 51-mile trip so his patients won't have to go to Northwood for care.
Brian goes to the outlying community, which is Binford, is where he usually goes, and he does that 2 days a week. They actually put a sign up. They have this digital sign that says, "Welcome to Binford." They appreciate him so much coming there to see his patients. He had a lot of patients that followed him from Cooperstown when he moved to Northwood Deaconess Health Center, and they are very appreciative. You know, everybody in town, the grocery store, everybody at the cafe always knows Brian's there. I make that trip once a month to Binford, which I think is a long ways to go, but Brian does it twice a week, and I'll tell you, his patients are very appreciative.
Brian has always been a patient-focused practitioner.
Nobody had ever checked my feet. Now, and this sounds kind of odd. Your feet, what's the difference? Well, I told him, my feet always hurt, Brian. What is that? And he says, you got flat feet. And I've been going to the doctor for many years, and nobody told me I got flat feet. I know this doesn't sound like rocket science, but I put in some cushioned insoles, and my feet don't hurt anymore. So that's just an example of the detail that Brian gets into. You know, when you say head to toe, in my case, that was literally head to toe, and I think he carries that everywhere.
Not only is he dedicated to seeing patients in the clinic, he has also spent more than 20 years covering the emergency room, hospital, and nursing homes in the Cooperstown Hospital, and for the past 6 years in the Northwood Hospital and Nursing Home. Brian is respected by his colleagues as well as referral physicians in Fargo, Jamestown, and Grand Forks. He has mentored and precepted several students throughout his career and has been an important influence in educating several graduating healthcare providers to practice in rural North Dakota.
I am so proud to be sitting here tonight to honor you for the commitment you have provided to rural healthcare. Congratulations, Brian, and hugs from all of us at Northwood Deaconess Health Center. We are so proud to work with you every day.
I've been blessed by a plethora of people who have impacted my life from birth to where I am now. And I'd just like to take the opportunity to thank some of them people. This is not all inclusive, but it's the people that tonight made this award possible for myself. First of all, I guess I'd like to thank my parents. They're the ones that taught me my work ethic. It carries over every day to my clinical practice. Thanks, Mom and Dad. To my mom, for teaching me the importance of a strong faith. And that faith has guided me every day in a clinical practice, in an emergency room. And without that faith and that recognition of the need to keep a strong faith, I wouldn't be where I was today. Thank you, Mom. To my nurses who've had the opportunity to be involved in my practice and make my practice what it is, thank you. You're truly the best. Thank you for your willingness to tolerate my type A personality and my little practice idiosyncrasies that have been successful. You mean the world to me. Oddly enough, I don't think as medical providers we respect or, frequently acknowledge our administrators, but I have an administrator by the name of Pete Atkinson, who's more than an administrator. He's a friend, he's a leader, he's the man that has made this all possible, believed in the process, and I want to thank you, Pete, for believing in me and the practice direction you've allowed us to take here at Northwood Deaconess. Thank you again, Pete. To my partners over the years of 20 plus years, I'd like to individually thank you all, but I can't. So I'm gonna point out the one that's been probably the most important to me. Miss Candida Ness, family nurse practitioner, partner, and a friend. We've been friends for 20 plus years, but partners for 6 years. We were the old NPs that were more devalued in the past, and we are the ones that have kind of paved the way to make NPs where they are today. And I thank you for that. I thank you for your type A personality, your perfectionism, and your practice expertise, and the philosophy of steel making steel sharper. You're the other part of the steel, and I thank you for that. Lastly, but clearly not the least, I'd like to thank my kids who have seen, or maybe more so not seen, their dad because of his practice. The ER calls, the weekends on call, the inconsistent work hours. You have been awesome. I love you for that. I love your patience that you've shown and allow me to pursue a lifetime dream. I hope you guys challenge yourself to the same career paths with some reward that gets you to that pot of gold. I'm not talking a financial pot of gold. It's the rewards that life holds as a result of pursuing your dreams. I appreciate everything that you have allowed me to do to pursue my dreams. And thank you, kids, and continue to keep the faith.
So congratulations, Brian. Congratulations on this award. You've obviously have a focus on patient-centered care that you've consistently provided over the last 20 years of practice, all of which you've spent serving rural North Dakota. Those sacrifices that you've made to dedicate to your patients has not gone unnoticed, certainly by your patients and your coworkers. Therefore, we're pleased to recognize you, Brian, as the 2021 Outstanding Rural Health Provider. So congratulations, Brian. The next award is for the Outstanding Rural Health Volunteer. This award recognizes the contributions made by a community person who has volunteered to contribute his or her energy, time, and skill towards the betterment of rural health care. This year's award recipient as the Outstanding Rural Health Volunteer is Dolores OJ, the activities aide for Montreal County Medical Center, an auxiliary member, treasurer, and volunteer at the Bethel Home in Stanley. Dolores was nominated by Lynn Patton from Montreal County Medical Center. So congratulations, Dolores.
Outstanding Rural Health Volunteer, Dolores OJ. Dolores OJ has been a fixture at Montreal Bethel Home, a nursing home facility under Montreal County Health Center. For years, she worked at the nursing home as a certified nursing assistant, a resident assistant, and an activity aide. As she retired, Dolores could not stay away. She continues to commit herself to the organization as the dedicated volunteer.
She's a wonderful person. I tell you, I'll never forget the many good times we had working together as partners. We've laughed, we've cried, she's a wonderful, wonderful person. Very kind, giving, and there was nothing she wouldn't do to help you. And now I work with her in activities on Fridays, and it is the same there. She's always willing to help.
For 11 years, she has served as the treasurer for the Montreal Bethel Home Auxiliary, keeping meticulous financial records and presenting detailed reports at auxiliary meetings. Dolores also lends her talents to helping with fundraising activities. She has taken on the task of keeping up the gift shop window at the facility. The window is filled with cutlery, homemade items available for sale to patients, residents, employees, and the local community. Dolores makes sure everything is well stocked and displayed in a pleasing manner, and she brings and sells items to local community sales such as the Home and Garden Show.
I just want to say that all the volunteer work she does so humbly and quietly that you don't even know that all this stuff is going on behind the scenes that she takes care of.
Dolores doesn't stop there. She is part of each fundraising effort, whether it be helping to cook and serve dinner, taking orders, or baking and serving bars. She is always happy to help with a smile on her face.
I had the pleasure of meeting Dolores about 6 years ago when I began working in activities. And she's just always inspired me. I can't imagine her not being around us and doing what she does for our residents. And she just inspires us to continue to volunteer and do what we can. Anytime I've ever needed her, she's always been there.
The wonderful thing about Dolores is she's always got a smile on her face. And even when you can tell she's worn out because she's worked really hard, she's still smiling and she's still happy and she's still a joy to be around.
Through her efforts, Many projects at the nursing home have been funded. She also takes the time to visit with residents. Dolores is appreciated by so many every day.
I totally enjoy working with them. And I want to thank everybody that nominated and submitted more info. It's just been a pleasure. This is my second home, my second family. I love them all. I want to thank everybody again for anybody that's involved in all this.
Dolores, congratulations on being named the Outstanding Rural Health Volunteer. I just love recognizing volunteers, those of you who dedicate your time and your talents for continuing to care for patients and residents that we serve. So thank you for doing that. You are a hardworking, reliable, enthusiastic model to all of us what a volunteer can accomplish if they put their hearts and their minds and souls to it. So therefore, we're pleased to recognize you as the 2020-2021 Outstanding Rural Health Volunteer. So congratulations, Dolores, and thank you for your work. The next award is for the Outstanding Rural Educator and Mentor. This award recognizes a professional who has made outstanding contributions to the education, development, and placement of new healthcare professionals in rural North Dakota communities. This year's award recipient was nominated by Annie Gerhardt from the University of Mary. And this year's Outstanding Rural Health Educator Mentor Award goes to Billy Madler, the Chair of Graduate Nursing Program at the University of Mary in Bismarck.
Outstanding Rural Educator and Mentor Award, Billy Madler. Dr. Billy Madler is the Chair of Graduate Nursing Education for the University of Mary in Bismarck. Her contribution to North Dakota's rural health care is demonstrated through her dedication and advocacy of developing nurse practitioners prepared to serve as primary care providers in rural health.
I've known Billy for a really long time. She actually is a graduate of University of Mary and was in one of our first nurse practitioner classes here as a graduate student. And through all of that, this time, as her practice in emergency room, her faculty positions here at University of Mary, and then personally as an educator in our university, the word that I would describe is passion. She has a tremendous passion for her students and for her patients and for knowledge. And so you put those three things together and you have someone who is always and full of energy, working toward what can be the best possible outcome for each of those populations.
One of her most recent achievements has been leading the University of Mary in Catholic health initiatives, north in obtaining and executing a $1.1 million grant from the Health Resources and Services Administration. The grant was innovative in its emphasis on developing curriculum for the rural healthcare family nurse practitioner.
Dr. Madler is an exceptional educator, and she's also an exceptional nurse practitioner. She is a person that I think each of us students of hers have tried to become like, or she's a person that she's a role model to all of us, and she has done so much for the nurse practitioner profession that we all should be grateful for her.
Through her role with the university, Dr. Madler directs 6 majors and has been instrumental in the development of not only the curricula of these programs, but also responsible for enrollment, faculty, scholarships, service, teaching, and budget. To foster opportunities to practice in rural settings, she has integrated a clinical program into the curriculum that sought out preceptors in rural health clinics and critical access hospitals where students were assigned for clinical placement.
Being born and raised in an urban area, I've had little to no experience of rural medicine, and being able to go into a rural health facility and see it firsthand was absolutely fantastic. And I would like to thank Dr. Madler for her tremendous contributions to my growth personally.
She challenges us, she motivates us. She has so much wisdom, experience that she really just wants us to do well, and anything that she can instill in us has been greatly appreciated.
She worked to prioritize rural needs by advocating for clinical rotation placement. She continuously pushes her students to learn how best to work in rural facilities. Dr. Madler demonstrates the utmost commitment, mentorship, and leadership to her students and colleagues, and to the public throughout North Dakota.
Hi everyone, this is Dr. Billy Madler from the University of Mary, where I serve as Chair of Graduate Nursing Education. I want to thank my nominators for putting my name forward for this award, and certainly am humbled by being selected, as I know there are many, many deserving people. I want to thank my faculty, who I am a huge cheerleader of, and who work their tails off to make sure that we ensure excellence and that we prepare students who are going to be high quality providers in the communities that they choose to practice. I want to thank my students who we challenge to the brink and who rise to the occasion every time. I want to thank my family for their enduring support and their inspiration that they provide me, and their tolerance of a lot of sometimes long days. And I want to particularly thank rural health communities and healthcare organizations in those communities, including the leaders, staff, and providers of those facilities. We send many, many of our nurse practitioner students to gain experience in rural health clinics across North Dakota and across the region. In fact, we require a rural health experience in our nurse practitioner program, and students find they're embraced by these communities and the providers and the staff in these clinics. They're challenged by the patient case mix and presentations, and they're really required to stretch their critical thinking and medical decision making, where sometimes there's not every resource that you might have in a more urban setting.
Congratulations, Billy. Through your dedication in advocacy, you have helped to grow the number of nurse practitioners practicing in rural North Dakota, along with supporting nursing in all arenas. Your devotion in developing competent, safe, advanced practice nurses through your interactions with students is recognized. We are pleased to recognize you, Billy, as the 2020-2021 Outstanding Rural Health Educator. So congratulations, Billy, and thank you for your work. The next award is for the Outstanding Emergency Rural Leader. This award recognizes a new professional who has demonstrated tremendous promise for and is committed to improving the health of rural North Dakota residents. This year's nominee was nominated by Teresa Will from the City County Health District. This year's award for the Emerging Rural Health Leader goes to Katie Beyer, Prevention Specialist and Partnership for Success Grant Coordinator at the City County Health District in Valley City.
Emerging Rural Leader, Katie Bayer. In the short time Katie Bayer has worked in public health, she has already made a difference. Katie is the Prevention Specialist for City County Health District in Valley City. Katie was hired to lead the work for the Partnership for Success Grant in 2016, and during that time she has worked closely with local and state colleagues to share materials and assist in developing statewide strategies to decrease underage alcohol use.
She's always upbeat. Open door policy, easy to get along with. That's things that's installed in you, and she has that ability.
She has worked closely with the Valley City Police Department to develop and provide scheduled responsible beverage server trainings, educating servers as employees change within local businesses.
Katie's work in her local community with her local leaders. One of those outcomes that she saw with this grant that we administered through the Department of Human Services was the server training law or server training ordinance, where it's a requirement that people who serve alcohol receive training for that, like how to look for fake IDs, how to identify underage drinkers, and then which ultimately reduces underage drinking and ultimately reduces consequences. So it was a huge success for her community to see this policy passed.
She has also worked to create new programming. With a friend and colleague, Katie developed the Not in My House campaign, which is now used in many states across the nation. Not in My House is a collection of grassroots community prevention efforts aimed at reducing youth alcohol access by raising awareness of social host liability.
She is inherently curious and always interested in any public health topic, from septic systems to healthy nutrition to opioid prevention. She's always ready to learn and then digs in to try to work towards solutions.
Katie is a very driven young professional. She's committed to her community and to public health, and I just really couldn't think of anybody else who is more deserving of this award.
Katie is an active member of the Barnes County Behavioral Health Coalition, where she has provided education and continually advocates for public health.
We've had the opportunity to work on a few big projects over the past couple years, and she's a team player. You know, she's very directed and focused on what she needs to do, but she doesn't just take over and assume all the responsibility or kind of push all of her viewpoints or solutions on. She even really allows people within a team to develop their own ideas. You know, she's just a thoughtful person that way, so that you feel comfortable thinking and contributing yourself. I mean, she just kind of has all of those qualities you'd want in a leader.
Katie displays wonderful leadership abilities. She is committed to decreasing underage drinking in the county and region. Her interest in public health starts with why are things done a certain way and how can they be improved for everyone in her community.
I just want to take a minute to say thank you to those who nominated me for the Emerging Public Health Leader Award. It means a lot to have your work recognized formally by peers and by people in leadership positions in the community. Their partnership is essential to all of the things that we do in public health, and specifically to the initiatives that I have been involved with. And so I just want to again say thank you to my peers and my colleagues, and to Teresa Will, who has been a wonderful mentor for me and has really opened the door to me getting started in public health and rural health care.
So Katie, congratulations on receiving this award for the Emerging Rural Leader. We look forward to all of the things that you'll be able to do throughout your career in serving residents of the state of North Dakota. You are continuously looking for ways to improve quality and increase efficiencies for everyone within your public health unit, which includes leading or assisting with projects within your public health unit, your community, and in the state. You provide education, advocate for public health, and have a drive to learn and develop solutions to problems. And again, congratulations on being recognized as the 2020-2021 Emerging Rural Health Leader. The next award is for the Rural Health Legislator of the Year. And this award recognizes an outstanding North Dakota legislator, congressional representative, or legislative aide for their work and support of rural and public health initiatives that address an unidentified need in his or her district. The criteria used to select this award recipient includes a person who introduces or supports existing piece of legislation that addresses an identified rural or health or public health need or issue, and a person who demonstrates leadership in the community, and a person who incorporates community input into their planning. This year's award goes to Representative Rick Holman from District 20 from the North Dakota House of Representatives, serving the Mayville and surrounding areas. Representative Holman was nominated by Gretchen Dobrovich from the American Indian Public Health Resource Center. So congratulations, Representative Holman, on receiving this year's award for the Rural Health Legislator of the Year.
Rural Health Legislator of the Year, Richard Rick Holman. Representative Richard Rick Holman is a teacher by education, a farmer by trade, and an advocate for rural health care issues as a community member and state legislator.
Rick has been in his political life for so long, but yet remained constant to our community and always available, and just has rural health and the health of our community at heart. And yet we don't often know, is Rick here because he's a representative for the state of North Dakota, or is Rick here because he's a member of our community? And it always intertwined, and it didn't really matter because we wanted him there and he liked being there.
Representative Rick Holman is a teacher by education, a farmer by trade, and an advocate for rural health care issues as a community member and state legislator. Representative Holman has served the people of District 20 for 11 years, which includes portions of Cass, Trail, and Grand Forks counties. During his time in the North Dakota House of Representatives, he has championed many rural health policies and fought for increased funding for rural health providers and services. One of the greatest impacts Representative Holman has had on rural health in the state was during the 2019 legislative session. The Insurance Department's budget bill included a provision that insurance companies doing business in the state could not consider pre-existing conditions in the event of a repeal of the Patient Protection and Affordable Care Act. Representative Holman successfully had an amendment added to the bill that stated, including waiting periods, refusal of coverage, and rate setting. This amendment guaranteed no North Dakotan could be refused insurance coverage, go long periods with no insurance coverage, or fall victim to rate setting should the ACA be repealed. He was also the tie-breaking vote to keep the funding for Medicare expansion in 2019. During his time in the legislature, he would often reach out to his local health care providers to gain their perspective of how they may be impacted. Representative Holman's commitment to rural health extends outside of the legislature. He has been an active member of the Eastern Area Health Education Center Board and serves on the Mayville State University RN to BSN Nursing Program Board.
Thanks for this honor. I recognize it's what I have done and I've done by working with others in the legislature and outside of the legislature. So this is a shared honor, and I hope I look at it that way. So, but thank you for recognizing the importance of healthcare in rural North Dakota.
Representative Holman, congratulations on receiving this award. You've championed many rural health policies and fought for increased funding for rural health providers and services. You have also been a champion to help ensure citizens with pre-existing conditions are covered in the event that the ACA was repealed. You will be missed by rural health advocates now that you have retired from the legislature. And I'm sorry to hear that as well too, because you have been a great champion for all of us in North Dakota. But again, we're pleased to recognize you as the 2020-2021 Rural Health Legislator of the Year. Congratulations again. The next award is for the Outstanding Rural Health Program. This award is presented to a program that delivers services in innovative ways through collaborative partnerships to improve the access and quality of care that's provided to rural North Dakota residents. Individual programs and/or organizations and facilities are eligible for this award. This year's award goes to Avera eCare School Health Program out of Sioux Falls. The Avera eHealth School Health Program was nominated by Robin Prunty from Avera McKinnon Foundation.
Outstanding Rural Health Program, Avera eCare School Health.
Avera eCare School Health has successfully found a way to bridge gaps in rural schools. The majority of North Dakota schools have been unable to afford nursing services due to funding or the rural nature of many schools. Avera eCare collaborated with Central Regions Education Association and the North Dakota Department of Health to find a solution. And the Avera eCare School Health Program began. In only 2 years, the program has begun working with 17 small and rural schools, serving approximately 3,200 with plans to grow. These are schools largely in central North Dakota, most far from urban areas.
Our kids, a lot of them lack adequate transportation. Their home lives are very difficult, and without these services, them getting to the doctor or the appropriate medical care facility just doesn't happen on a regular basis. What this has allowed us to do is just do a lot of unique things to keep our kids healthy. We've actually seen our attendance be better this year, which has been great. We've ticked up a couple percentage points. The kids are healthier. I think they're happier. I know we have a very severe diabetic student. It's been life-changing for that student, where we can check blood sugars regularly. And that's been a big difference as well. So I just think allowing all that to be available for our community and the kids that we serve and the people that we serve has just been very, very beneficial, and we couldn't do it without Avera eCare.
The program serves students in so many ways, including how to manage diabetes or asthma, curbing absenteeism, or health complaints surrounding stress at home, hunger, bullying, or behavioral health issues. This is all done through a network of school nurses using telemedicine. This allows a nurse in each of the 17 schools without having to hire 17 full-time nurses.
We were the first school in North Dakota to employ Avera eCare. And one of those was that we were hoping it would evolve into behavioral health. And it has. And so we also have that in our building. And we're hoping that it is the bridge for kids who are reluctant to go to your school counselor. Because in small schools, the counselor, you see them out in the real world as well. And kids might be reluctant. But now they know I could talk to someone, and I may never see them in my lifetime. But I get to talk to someone, I can talk about my issues, my concerns. So it's been a wonderful thing for us, and we're hoping that we can continue it.
The nurses are able to work with the school, parents, doctors, and most importantly, students, so they can safely participate in educational and extracurricular activities.
The Avera eCare School Health Program is a deserving recipient of the Outstanding Rural Health Program Award because they are a leader in innovative medical care through the use of a telehealth platform. They're also incredibly interested in authentic partnership.
The nurses have been able to build trust with the families they work with and are helping to not only build healthier students in schools, but also healthier communities.
We have a team of nurses, school staff, therapists, principals, superintendents, parents, IT people. It's a big team effort. And so each person plays a part in keeping the kids safe and healthy at school and able to learn. And the amazing thing is, just as I'm speaking to you now virtually, there are relationships that are developed, whether it's over the camera or whether it's in person. And that is really what this program is about, is bringing that medical expertise across the miles to schools so that children can be safe and healthy no matter where they live. I'd also like to thank the Avera Foundation, Robin Prutney and her team for writing the nomination. And then, of course, Avera eCare for taking the chance on the program in the first place. The program actually started when the Sioux Falls School District came to Avera and asked if there was any way they could help with nursing services. And through this innovative process, the virtual school nurse was born. And so I think that when you think about innovation, you think about need. And innovation is born out of need. And so this is a perfect example of that. So I just like to thank everyone for that opportunity to serve the kids. And we look forward to continuing to serving children in North Dakota, keeping them safe.
So on behalf of all of us and the students and the families that you serve, congratulations on being selected as the Outstanding Rural Health Program. Avera eCare School Health Program serves the increasing number of student health needs through a time-efficient and cost-effective program connecting rural schools with a registered nurse via telemedicine. 16 North Dakota schools that otherwise would not have access to supervised daily medical care and medication administration now have a means to receive these services. So again, we're very pleased and proud to recognize your program as the 2020-2021 Outstanding Rural Health Program. The next award is for the Outstanding Rural Health Career. This award is presented to a healthcare professional who has devoted his or her career to making significant contributions to improving healthcare in rural North Dakota. This year's award winner is Dr. Erling Martinson, a physician at Nelson County Health System in Mackville. And Dr. Martinson was nominated by Kathy Swenson, my good friend from Nelson County Health System. So congratulations, Dr. Martinson.
Outstanding Rural Health Career, Erling Martinson, MD. Dr. Erling Martinson chose to spend his 40-year career practicing in small rural facilities. He is currently the medical director for the Nelson County Health System Hospital and Clinic in Mickville, where he has dedicated his life's work. This is despite getting offers from larger facilities over the years.
Dr. Martinson has dedicated his work and life to Nelson County and Nelson County area communities. He believes in rural health care and continues to provide services to our long-term care facility as well as the hospital.
Dr. Martinson's commitment to the employees, patients, families, and Nelson County communities is exceptional, and his leadership is an inspiration for all staff and colleagues within rural healthcare. Dr. Martinson covers a significant amount of emergency calls at Nelson County Health System Hospital. His knowledge and skills are undeniable, as demonstrated by his many successes in providing initial, quick, and decisive emergency care prior to transfers. He exudes self-confidence, putting both patients and staff at ease. In harrowing situations, he has no problem bringing staff together as a team, with each person knowing their role, and he provides calm and coordinated care. He is a provider whose education is ongoing. He also supervises mid-level providers.
Dr. Martinson is truly a good listener. He actually wants to give the patients the time that they need in order to convey to them what their need is. And he actually wants to give them his time, enough time so that he feels that the patient feels that they've had his undivided attention.
Dr. Martinson is respected for his calm, caring, and thorough examination to healthcare. Not only does Dr. Martinson possess the medical acumen, but also wisdom. He understands medicine as science and art. He consistently shows professionalism by being respectful of his peers, identifying other alternatives which may be more appropriate, and willingness to compromise and or refer if it benefits his patients. Dr. Martinson has demonstrated leadership in the delivery of rural health services and has made significant and sustained impact on the health of the community he serves.
The longevity or time lasted in the career is a result of excellent support and help, aided by good health. As I started to think through that a bit more, remembering all the great, dedicated people that have helped prop me up, encourage me, and keep me going over the years, my reservation and my inadequacy about receiving this award turned to excitement, as I now get to brag about all the terrific people that have surrounded me, and that this award is as much about them as it is for me. So with that being said, let me do a quick flyover of some of those responsible. First, the nominators. Thank you, Kathy Swenson, for I suspect you spearheaded my nomination, and also to the Department of Rural Health for establishing and offering the recognition. And of course, Kathy's main partners who supported her in the effort and who also submitted recommendations on my behalf. Steve Forte, CEO of Nelson County Health System, Dr. Tam Zarnik, a very dedicated and deserving colleague who also would be an excellent candidate for this award. Also, Dr. Bill McKinnon, medical school classmate and a perfect liaison between our smaller rural hospital and our frequent helper in the big city nearby, Ultra Hospital. And also to Judy Tweet, President of the Nelson County Health System Hospital Board, who herself was an award winner several years ago for Rural Health Volunteer Person of the Year.
Congratulations, Dr. Martinson. You have unselfishly committed yourself to rural health, not only in providing quality care, but also in going that extra mile and helping with the other things that just need to get done. You're always willing to take call or pitch in to help no matter the task. Therefore, we're very pleased to provide you and recognize you with this award for the 2020-2021 Outstanding Rural Health Career Award recipient. Congratulations, Dr. Martinson, and thank you for your service. The last award, but not the least, is the award for the Rural Collaborative Opportunities for Occupational Learning in the Healthcare Scrubs Camp program. The Our Cool Health Scrubs Camp of the Year award is presented to the grantee that hosted the Scrubs Camp, deemed as the top camp of the year based on the overall combination of a number of factors, including professions students are exposed to, innovative and interactive activities, collaboration of community partners and local healthcare professionals, and the organization of the camp and the grant success. This year's award goes to Towner County Medical Center, the Can-Do Area Scrubs Camp. Congratulations on this award for the Our Cool Health Scrubs Camp of the Year. Amy?
Our Cool Health Scrubs Camp of the Year, Towner County Medical Center. How do you get people excited about finding a career in healthcare? You introduce the idea to them when they are young, and that is precisely what Towner County Medical Center did. They hosted an amazing Our Cool Health Scrubs Camp. Towner County Medical Center collaborated with Towner County Public Health, Towner County Living Center, Can-Do Fire Department, Towner County Ambulance Service, Newman Drug, North Star Public School, Mount Pleasant Public School, and Starkweather Public School to host the 2020 camp. Students attended from several communities including Can-Do, Rolla, Starkweather, Bisbee, and Eglin. More than 30 students in grades from 9 to 12 from North Star Public School and Starkweather Public School participated in the fun, interactive activities promoting careers in the healthcare industry. 20 health professionals presented different careers to the students and included hands-on activities including IVs, taking x-rays, drawing blood, and intubating a practice mannequin. An evaluation given after the camp shows 3 out of 4 students who went to the camp not only were interested in healthcare, but are now considering it as a career. The Our Cool Scrubs Camp of the Year honors the top camp of the year based on overall combination of the following factors, including professions students are exposed to, innovative and interactive activities, collaboration of community partners and local healthcare professionals, and organization of the camp and grant process. This was the first time Towner County Medical Center hosted a Scrubs Camp, and only the second time the Our Cool Health Scrubs Camp program has awarded a Camp of the Year to a first-time Scrubs Camp. Several of the campers had their interest piqued by the camp. Some of the comments campers left included, "I didn't realize how much I enjoy working with other people. Nursing, radiology, and working at the nursing home were cool, and I'm now interested in a nursing career."
We're doing the Scrubs Camp today because we are trying to get more youth interested in long-term care. Trying to get them more interested in becoming a CNA and to grow our own, to get more people local interested in working for us. And eventually, if they get their CNA, eventually there's more opportunity for them to go on to nursing and open up more doors for our youth.
So congratulations, Towner County Medical Center. for being selected this year's Our Cool Health Scrubs Camp of the Year. Because of your exceptional planning, along with the outstanding employee and community support that went into hosting your first ever Scrub Camp, we are pleased to recognize you as the 2020-2021 Our Cool Health Scrubs Camp of the Year. So congratulations to you. And congratulations to all of you as award winners. We thank you for the work that you do, and certainly the impact that you make all across the state of North Dakota to those of us who are blessed to call rural North Dakota home. So thanks for all of you and your families for the work you do again. And thanks for all of you who stuck around. And Dolores, I know you're still with us. If you have a recipe you want to share with me, I'm certainly willing to take it, okay? Make it a good one. Anyway, thank you all. Kylie, I'll turn it back over to you unless we're done with the program and we're signing off.
That's it. We're done. Thank you very much, Gerald, and thank you all. Have a great evening.
Right. You guys all have a good evening and stay cool for sure. Good night.